All right, thank you for staying with the Monday Report. Let's bring in Colonel Cyrus Oguna is joining us live right here in Nairobi to answer all the questions that you have in regards to the restricted movement and anything else you need to know in terms of the government preparedness. Colonel, thank you so much for making time for us this evening. So help me understand this, Colonel. If a family has a burial in, say, Murang'a or Nakuru tomorrow, all planned out, what do?
Thank you so much for inviting me to the studio and for inviting me to this show. Indeed, the directive that has been issued that there is no movement out of Nairobi town beginning tonight applies to everyone, really. And for those that indeed, this directive has been a long time coming. For those who might have not been so keen, the Cabinet Secretary, Ministry of Health has been giving caution that people should not move out of Nairobi. People should not come into Nairobi. And he's done that a couple of times. So essentially, when it was made today, basically, for those who have been keen, would have known that it is actually coming. And therefore, for anybody who might be having a body to bury out of Nairobi, essentially what that means is that that body will have to be buried here because we cannot risk the lives of those people who are out of Nairobi town.
So what if you can't afford it, Colonel?
Johansson just did mention that for those who are unable to afford, the government is looking at the possibility of trying to, to subsidize, to help out where they can be, it is necessary. So there is, a discussion with regards to what can be done, to ensure that, if a body is in Nairobi and it must be disposed of within 24 hours, the government will look at a way on how that can be done within that space of time.
Colonel, are there any exceptions? Picture this, a mother or a father who's left a child in Nairobi under the care of a relative, traveled to a different place, meant to come back. So what happens? Are there any exceptions?
Listen, there is no mother really and a parent that would leave a child without the care of anyone. And indeed, you must also be very, very careful here. A mother who is gone out or a parent who have gone out of Nairobi town and left the child, here in Nairobi, the possibility of also even them bringing back infection to that child is very, very high. And therefore, anybody who has gone out of Nairobi town and is out there outside the time frame that has been given by the government, then it means that that person will have to find alternative arrangements.
So, Colonel, just help me understand this. What about the people who offer essential services? Are they then allowed to move from one county to another?
Hello?
Colonel, my question is...
Ask that again.
What of the people who offer essential services? Are they allowed to move from one county to another?
Essential services, have been very well defined, what they are. Remember, even when the curfew was called for, essential services were very well, spelled out what they are. And therefore, if you are working in Nairobi, for instance, and you live in Machakos, for that matter, and if you're working here, then you must make arrangements on how you can be able to, to be accommodated where you live. Where you work. If you cannot be able to do it, then you must find arrangement with your employer so that you can be out of work until such a time when, the period of, that restriction of movement expired. That is 21 days. So because we cannot risk, really, to allow movement in and out. The whole idea is to prevent, transferring infection from one county to another. And people must understand this.
So, Colonel, there's the curfew where essential services are allowed to move even beyond the curfew. And then there's the restricted movement. So the essential services people can't move past any county except they can move beyond the curfew. Is that what you're saying?
Essential services are well spelled out. If somebody is in Nairobi, for instance, or somebody is a doctor, and somebody is, for instance, moving out of Nairobi to, say, Kitengela and a little bit beyond towards Kajiado area, there will be those very, very, specific professions whose role is very well spelled and is known, and therefore they are offering essential services. These are movements that may not be really essential, and these are the movements that have been curtailed. The other movement that is allowed, that is considered to be essential, is movement whereby vehicles can move in to any of those counties to provide, what we can call farm produce, because people must continue to eat, and therefore there must be open supplies of food from those areas where food is normally grown. So those areas are actually exempt, and those professions are also exempt.
So, Colonel, just for my own understanding, so can a doctor move from Nairobi to Kisumu tomorrow?
There would be no reason for a doctor to move to Kisumu because there are other doctors that are there. But I'm talking about a doctor who is staying, for instance, in Kajiado, and he works in Nairobi. That doctor offers essential service, really. And for that one, he can be allowed to move because of the nature of his work. But a doctor moving way out of Nairobi town, that one cannot be allowed.
Okay. But also there's been a complaint from health workers who say that despite them giving the documentation and proving that they're health workers, they're still harassed by the police.
I think that is something that is administrative, really, because for those who offer essential services like nurses, they're supposed to have badges. And those badges are supposed to be used whenever they come into contact with the police or meet where there's a roadblock. They're supposed to be able to show those badges, and therefore they would be let to pass and go home. But when they don't have those badges, then it becomes very, very difficult for the police to know really whether they're nurses or not. So really, this is something that can be very easily worked out, and in terms of having the appropriate badges to allow one to present their case to the police, and the police would let them actually go home.
Yeah, Colonel, now that you said that this was a long time coming and there was warning, the president has also warned that there might be potential stiffer actions. 68% of Kenyans, according to Infotrack, want a total lockdown. What is the threshold for a lockdown?
This is not a one-man, decision. To have gotten to a point whereby we are restricting movement from out of Nairobi or out of Kwale, Kilifi, and Mombasa, it has come out of an analysis of development that have been seen as far as the infection rates are concerned, and therefore the same committee will be able to view the situation as it develops. And should it come to a point whereby now it requires that there is a total lockdown, then that committee will be able to make that decision at the time. Right now, I cannot tell you that this is the threshold because there are so many other considerations that must be made in as far as infections are concerned.
Okay. And Colonel, what happens to people who have emergencies at night and cannot afford ambulances? I'm speaking about someone who I know who operates a PSV and had to take a pregnant lady to hospital. On his way back, his vehicle was impounded. What happens to people who can't afford ambulances and they have emergencies at night? Who do they call?
They don't have to afford ambulances. Not everybody will afford ambulances. And this is, we understand our socioeconomic realities in this country. Not everybody can afford an ambulance. But we know that there are numbers that one can be able to call. There is the St. John's, the Red Cross number, the police, toll-free line. We have got the 719. All those numbers are there for anybody who has got an emergency, cannot be able to call for an ambulance, call those numbers, and they will be assisted. And there are many who have been assisted, really. So that is something that can be sorted out very, very easily. But these numbers are important for people to have them in their houses.
But Colonel, the response time to those numbers takes a long time, and this has been evident. So we know this from experience, the response time. If this is an emergency, you need to go now, the guys you call won't show up on time.
Well, I cannot talk about what basically hearsay. There is the evidence that it takes a long time for an ambulance to respond. Honestly, if you call the police today, they will be respond at a time when they are able to respond. You may remember that we must also be cognizant of certain realities. That there is no set time that a certain emergency call must be responded within 2 minutes. They will always respond at a time when they are able to put certain logistics together and respond to that emergency. So let's be a bit also fair to them, and they have done so well up to now.
So there's a push by government of Kenya to have people wear masks in public places. There's a story we just did earlier on where a border operator is saying for him to buy a mask, it costs him 50 shillings. That ride itself is 50 shillings. Is the government planning to give free masks?
the government was very, very clear that there are about 40 million masks that will be produced and will be distributed to almost everyone through the county governments. And until that time, which may be any time within the course of next week, that people are also advised to be able to buy their own mask as opposed to waiting for what the government will be distributing free of charge. Remember, health is everyone's responsibility, not only the government. My health is my responsibility first and foremost. Then the government comes in. Now, if having a mask can be able to reduce the chances of me getting infected, why don't I just buy one before this one from the government comes? And therefore, we must also be able to tell our people to take some bit of responsibility, to be mindful of their own health, not looking at the government in everything. I know the government there is what the government can do, but this is what I must do myself before the government steps in.
All right, Colonel, I have a question here from Catherine Ochieng, who says, how about people who stay in Kajiado and work in Nairobi? Does it mean that they will not go to work?
And that's exactly what you're saying, really. You are out of Nairobi, metropolitan. And there are two issues here. You either stay in Kajiado and work, then make arrangement with your employer, or your employer gets you accommodation in Nairobi town. It's very, very clear. We cannot be able to allow people to move in and out of Nairobi. Then you'd make nonsense out of this directive. And therefore, really, the advice here is this, that if you are staying out of Nairobi town, but you're working in Nairobi, either make arrangements to live in Nairobi for the period of 21 days, or make arrangements with your employer so that you can be able to work from home in Kajiado if you live in Kajiado.
All right, I have another question here who says, kindly ask Oguna to clarify the issue of the Likoni ferry. So Likoni sub-county is in Mombasa County, and the sub-county has a high percentage of labor force that lives in Likoni and works in the island. Does it mean that they will not be allowed to go to the island, which is within the county they live in?
What you're saying right now, honestly, people must also be able to understand this, that Mombasa, Kwale, Kilifi have all been taken as one single unit. And therefore, inter-county movement between this county as of now has not been restricted. What has been restricted is movement out of those three counties into counties like Taita Taveta, counties like Lamu. So come Wednesday, 7 p.m., 2 days from now, there will be no movement out of those three counties into either county of Lamu or county of Tana River. For now, county of Tana River, county of Taita Taveta, county of Lamu can move into Kilifi, Mombasa, or even Kwale. But come Wednesday at 7 p.m., all those movements will be suspended. But however, movement between Kilifi, Mombasa, Kwale will go on until curfew time. So that is something that the government has made very clear.
Colonel, that was not clear because there was a perception that the movement from Mombasa to Kilifi and Kwale will be restricted. So you're saying they're one unit. So there will be movement between Mombasa, Kwale, Kilifi from Wednesday.
As of now, there will be one unit. Okay. Let me again, just become more clear on this.
Yeah.
That Kilifi, Mombasa, and Kwale, they have got a lot of interaction and engagement and relationships. And therefore, they have been taken as one single entity, even though they are different counties, but it's been taken as one region.
Okay.
And therefore, movement within that region has not been restricted.
Okay.
Except at night during curfew.
Okay.
Now, come Wednesday,
yes,
at 7 p.m., then there will be no movement into those three counties from neighboring counties.
Okay. But the ferry services will operate as normal as long as they adhere to the curfew times within those three counties?
Yes.
All right.
Unless other directives are issued. But right now, that is the position.
All right. Colonel, I want to bring up some questions that people sent in for you. Let's bring up the first one.
Hi, Trevor. My name is Beth Elkana, and my question goes to the spokesperson of the government, retired Colonel Cyrus Oguna. And my question is mostly concerning the public awareness. What is the plan that the government has on public awareness?
Colonel, public awareness is his main concern.
Yeah, thank you very much. Public awareness is a very important aspect of empowering the people in as far as this fight against COVID is concerned. Because when you become aware you are armed sufficiently to be able to know what to do and to be able to know how to combat, this disease. And there are various programs that we are doing as a government to ensure that our people are very well informed in as far as this fight against COVID is concerned. We are reaching our people through various channels. We are reaching them through TV stations, we are reaching them through FM stations, we are reaching them through newspapers, we are reaching them through publications and even IEC posters and billboards. You have seen many of them. We've got social media messages that are reaching our people. We know that a lot needs to be done, and we will do that until a time whereby we will be sure that every Kenyan is armed sufficiently enough to be able to combat this disease.
All right. Colonel, there's another question about someone who's quarantined here in Nairobi, but they don't come from here. They just landed in Nairobi, but they needed to go to other places. What happens to them after the quarantine period is done?
If they have to go to other places, I don't know which are these places. And for as long as it is not, a desire to go any other place out before the 21-day elapses, if it is within the 21 days, then he or she will have to stay in Nairobi.
All right.
That is the position.
Okay, let's bring up another question.
I think this is something that you have to make very, very clear, that it is within the 21-day period, no movement in and out of Nairobi.
Okay. Let's bring up another question for Kano.
So my question is this. There are those who are saying that they will be traveling using matatus, but when they get to the borders of this country, they will be using food. So how will government deal with that?
Kano?
Again, that question points to perhaps, complacency. It points to, perhaps people do not understand really what we are fighting. Because if you get to a border point between one county to another, and then you ally it and use those unofficial routes, basically what you are doing is essentially, trying to transfer that disease to other people, really. Because there is nothing else that would make you do that if, you know very well that you're actually breaking law, unless you know your condition and you're willingly transferring to other people. If you're a court, of course, you will be arrested. And therefore, we as government, we are appealing to our people to obey the law. What the government has done is not for the benefit of anybody else, except for ourselves as Kenyans, really. Remember, out of the 158 infections that we have, almost 126 are coming from one county. The other county, Mombasa, has got about 14. Now, and many people may already be infected, but you can't tell. So if I am moving out of Nairobi and the vehicle takes me to, let's say, Athi River, then I alight and then across, using those unofficial routes to cross into Machakos, how do I know that I'm not infected? How do I know that I'm not transferring this infection to the people of Machakos? And therefore, this is something that calls for a high level of discipline, a high level of integrity, a high level of morals, so that we can all understand that this is not something that government can fight on its own. It's something that all of us as a people must come together and be able to combat this disease.
All right.
Leaving it to the government to supervise it will not be able to help us much. You must take responsibility as an individual.
All right. Colonel, there's a lot of interest on this question of restricted movement, so I'll just keep posing them as they come in. Evelyn Kerubo says, ask Colonel that we had booked my flight from Nairobi to Kisumu tomorrow. So what happens? Do I get refunded?
Now that is something that he or she can take up with the airline. But indeed, if he had traveled today, it would have been better for him. But traveling tomorrow is out, really. This is something that is non-negotiable. The lives of 47 million Kenyans cannot be put in jeopardy because of one individual. It can't happen. And this is something that you must continuously keep on informing our people. This is a time whereby if somebody can ask myself, is my travel in Kisumu more important than the lives of 47 million Kenyans? The answer is no. And therefore, our people must understand that this is done for the benefit of the people of this country.
All right, let's bring up another question for Kano.
My name is Bright. I'm in class 8. I'm doing virtual learning. And my question is, why are the police officers engaged in the curfew enforcement as directed by His Excellency the President not given adequate protective gear? Thank you.
Kano?
Thank you so much for that question, really, about providing our police officers with PPE, personal protective gears. Indeed, we understand that they are playing a very, very important role in as far as enhancing our security and maintaining security in our country is concerned. But not every police officer will be in contact with somebody who is COVID. But in addition to that, even the police themselves have been trained on how they can be able to ensure that even during their patrolling, they are able to maintain the 1 meter social distancing. So they have been trained. However, we do understand that there will be situations whereby they may get into contact with certain kinds of people. For those who may get into contact, certainly we'll be able to provide them with PPE so that they can be able not to necessarily endanger their lives. We need police officers. We need them because when they are infected, the security of the country is compromised. Not just the police officers, but even prison warders, Kenya Defense Forces, personnel. So we must ensure that people and disciplined forces who provide security for this country are protected from the disease. And for those who may be in the front line of combating this disease, either by controlling crowd, they must be given protective gear, and we will ensure that they get protective gear.
All right. Colonel Anthony Musabi on Twitter says, can I come for my medical checkup at Nairobi's KNH from Nakuru? Because Nakuru hospitals referred me there. So it's not that I have an option in Nakuru.
It is unfortunate at this time. You will have to get treatment at Nakuru until this lockdown, this restriction is lifted.
All right. Let's bring up another question for Kano.
Hello, about the masks. I wanted to ask which type of mask should a person use? I know the government has said that we use the 3-pile masks, but I wanted to confirm if the masks that are made out of clothing or cotton, is it durable, and does it prevent the virus from getting into your respiratory system as effective as the surgical mask?
Kano?
Well, I'm really not a doctor, and therefore I'm not going into the technical details of how a mask should be like. But what I can tell you is this: that yes, there are masks that will not be able to help you, from contracting, the virus because of the way it is made. All right? But the masks that the government is providing, the 40 million the government will provide, are made according to specifications that have been provided by the Ministry of Health and also cleared by Kenya Bureau of Standards. And therefore, those masks, when they come and you get them, you will be able to be protected from, getting this disease. However, from what we are being told, that the mask may not necessarily protect you as much if you keep touching contaminated surfaces. So mask by itself may sometimes give you a false sense of security. What is critical really is that you must persistently and continuously maintain good hygiene. Wash your hands using water, running water with soap for not less than 20 seconds. Maintain social distancing of not less than 1 meter. And therefore mask is just an additional requirement to be able to protect you. But realistically, those are the known measures that will help in combating this disease. And therefore, when the government provides masks, or even if you can buy a mask, some of them are just providing protection against dust. Well, but like I did mention, I'm not a doctor. I will not give you why we have got the 3 layers. The first layer, what is supposed to do, the second layer, and the third layer. Okay. But realistically, there are those that are just cloth. And even you yourself can be able to see that this is just a cloth. If you put it into your eyes and you can be able to see through it, then certainly it's into a mask that can be able to provide you any protection.
All right, Colonel Solomon Kenyatta on Twitter is asking, can I use my private vehicle in case of emergencies?
Yes, you can use your private vehicle in case of emergency. The policemen are human beings. They are not robots. They are people who are rational. You will explain to them that you have an emergency. Some of them have been known even to provide assistance. And therefore, if you have genuine emergency, certainly you can use your vehicle to take that person to hospital. If you meet a policeman on the way, explain your case, and of course you'll be listened to. These are our people. They're not people from another world. They are Kenyans like you and I. Explain yourself, and they'll be able to provide guidance and even assistance.
Okay, let's bring up another question for Kano.
How is the country prepared to tackle the disease if it penetrates to other counties? Do we have enough ventilators and PPEs and enough medical staff in other counties except Nairobi and affected areas?
Kano?
We have, as a government, worked increasingly hard to ensure that we have sufficient protective gear. We have been able to provide, enhancement of capability in our health facilities. But ventilators globally are an issue. But this is not a Kenyan problem of our own. It is a global problem. You realize that because of the disruption in supply chain, even getting these ventilators from other suppliers is an issue. Even major countries, the first world countries, are having problems acquiring them. The beauty about ourselves here is this, that we are able to manufacture, we are working with various local manufacturers to be able to provide these ventilators locally. And even PPEs, and therefore we will not necessarily have a shortage of the PPEs. But remember again, PPEs are actually expendables. They are things that you cannot use today and use them tomorrow. And therefore we'll continuously keep on producing them and giving them out to people who really need them. These are our frontline workers, the healthcare workers, that we must continuously keep providing with the PPEs. So don't worry, we have enough capacity and capability in the country to produce PPEs, and they'll be given out to those who really must have them.
Okay, Colonel, Evans Kipkura is asking on Twitter that my wife is breastfeeding. She went for a job meeting in Naivasha today, and she's supposed to return tonight. What happens to us now?
That is quite unfortunate situation, really, that, it's very, very, delicate as well. It's a young child. And indeed, that is a situation that may be looked on its own merit, really. That is a very delicate situation. But of course, if it is true, because there are those who just talk about this situation, but they're not necessarily very true. But if you've got a young child, maybe 1 year old, let's say less than a year old, that require that they must be in the presence of the mother. We are also human beings, really. And therefore, what would happen is that when that mother comes, if at all is allowed to come based on the circumstances that she is in, then she may have to go, test for COVID to ensure that when she was out there, she did not, contract it from Naivasha.
All right, so Colonel, you're saying essentially if Evans Kipkura's wife explains herself that she's breastfeeding a child and she was in Naivasha, she'll be allowed back?
What I'm saying is that there are those very delicate situations, and indeed we are human beings. We will not necessarily pretend that we are not human beings. So a case like that, really, where there's a young baby, hardly 1 year old, that requires the presence of the mother, it is only logical that that case be addressed in a manner that can be able to give that young child some protection that she can only get from the mother.
All right, Colonel, stay with me for a bit. We're taking a quick break. When we come back, we still have a lot of questions from people who sent their video questions, and we'll pose them to you in just a bit. We're taking a quick break here on the Monday Report. We'll be back with much more in just a bit. What we know so far, there's new information coming through to us is that the